Come in and have a seat, and we'll get started. Thank you for joining us again. We have lots of amazing topics still to cover, so keep telling your friends and relatives and enemies to come. Let's begin with prayer tonight. Father in heaven, in the name of Jesus, we pray for your Spirit to be poured out in this place in special power. We pray that you'd press back the forces of darkness, that you'd give wisdom and discernment as we contemplate these things and speak to our hearts and minds. I pray that you would control my lips. In Jesus' name, amen. All right, tonight we're talking about the power of water. We didn't do a whole lecture on water, which I could do, but we did have a little bit of a touch on the power of water as a medicine, right? I'm going to take a quiz now. How many red blood cells fits in a drop of blood the size of the ball in the end of the ballpoint pen? Huh? 5 million. 5 million, yeah. All right, good. So water is very powerful on the inside of your body. Very, very powerful medicine. Don't underestimate it. When you get sick, just start drinking, a glass of water every hour. If you'd been doing that all along, you probably wouldn't have got sick. But you'll get over the sickness way quicker that way. So tonight we're going to talk about using water as medicine on the outside of the body, because it's not just powerful on the inside, it's also powerful on the outside. So we're talking about hydrotherapy. What is the largest organ of your body? Skin. Your skin. And your skin is actually an important thing. It helps make a barrier between you and the outside world. But it's not as much of a barrier as you think, because it actually absorbs a lot of stuff that you put on it. And I think you ought to think about this a little bit when you start putting stuff on your skin. It absorbs up to 60% or more of what you put on it. So, mechanics, be careful what kind of stuff you put your hands in. Solvents, those kinds of things, paints, thinners, put some gloves on if you're going to have to touch that stuff. Even creams, deodorants, chemicals, all these different things, paints, they can have all kinds of things in them that are toxic to the body and soak in through the skin. The average square inch of skin holds 650 sweat glands, 20 vessels, and over 1,000 nerve endings. 1,000 nerve endings. So that's amazing, 20 blood vessels. That's not really counting all those little capillaries. Our skin is actually an organ of excretion. It helps us to get rid of toxins and other byproducts of metabolism, things that we don't want to build up in our body. It eliminates toxins through sweat, generally. Sodium, urea, lactate, lead, and many other things can be sweated out through the skin. So if someone has toxic buildups in their body, one very powerful way of helping to detoxify is to sit in a sauna. Make yourself sweat. Be sure you hydrate yourself well when you're in a sauna, okay? Because that's one potential thing. If you get dehydrated when you're doing this, you can have some side effects, as we'll talk about in a moment. The average adult has about 32 milliliters of blood per pound of weight. Now, I want you to let this sink in for a moment, because that means someone who's 150 pounds has about 4.8 liters of blood. That means someone who's 200 pounds has 6.4 liters of blood. Think about that for a second. Your body has to manufacture more blood to service the extra pounds of fat. There's actually extra miles worth of blood vessels in every pound of fat. So it's putting an extra an extra work on the heart to have to pump blood through all those extra miles of blood vessels. So that's really not good. And think about this too, when you lose weight, your body has to resorb not only all that fat, but all the blood vessels that are servicing that fat tissue, because the fat tissue is living tissue. And it has to have blood supply to it. So when you add those pounds, you're actually adding a whole bunch of extra tissue that has to have blood supply to it, which is why overweight and high blood pressure go along together frequently, because your heart is now having to push the blood pressure up to get all that extra blood through all those extra miles of vessels. Now, when the entire body is heated, that's called hyperthermia. The skin is actually capable of holding 6 to 8 liters of blood. That's more blood than you have. How does the skin hold all that extra blood? It's because the blood vessels start to dilate. Blood vessels aren't like garden hoses. They're living tissues, and they can constrict or they can dilate. When they dilate, there's a whole bunch more volume there. Is that right? So now what happens when you get hyperthermia, you get heated up, and your blood vessels all dilate, and all your blood is in your skin? What could happen? You could have not enough blood flow to the brain. So this is the main potential side effect of doing hydrotherapy. You need to be careful. You need to have a knowledge of this, because you could theoretically die if you didn't know this, right? Because if you're all dilated and your skin is filled up with the blood, there's not enough blood now going to your brain, what's going to happen? No? No? You're going to pass out. You're going to pass out. You're going to faint because there's no blood to the brain. Now, fainting in itself is not fatal, but if you fell over while you're fainting and you broke your neck, that could be fatal, right? So as you do hydrotherapy, you learn how to do hydrotherapy. You have to be aware of the fact that you're dilating your vessels, which means you want to stay hydrated, because that makes, if you're dehydrated on top of dilating your vessels, now you have even less blood in there, right? So by staying hydrated, that helps to fill up the blood vessels more so that you don't have that as much likelihood of dropping your blood pressure. And if your blood pressure starts to drop and you start to feel faint, what are you going to do? You're going to get gravity working on your side, right? You're going to get your head down, right? Hold on to something, get your head down, lower than your heart. Now you're helping so that the heart isn't trying to pump that little bit of blood up. It can now flow down with gravity. Is that clear? Usually, if you start to feel like you're going to faint, for whatever reason, if you get your head down, you won't faint. Okay? So that's very important to know and understand as we talk about hydrotherapy. Now, I showed you this slide on the first night, but I want to mention it again because this is a very important concept. In one study, they tested the patients while breathing supplemental oxygen. They measured their subcutaneous oxygen pressure, and it was measured at 47 millimeters. That's while breathing extra oxygen. After applying heat for 42 minutes, the tissue temperature rose to 100.4. The regular tissue temperature is about 93. Remember, 98 is your core temperature. 93 is your outside temperature, right? And the partial pressure of the oxygen rose to 87.2. That's almost double the amount of oxygen going in your tissues by applying heat. Now, I told you some of the wonders of hyperbarics, and I didn't tell you that much, actually, because there's a whole much more that I could tell you. I have a whole lecture on that, multiple lectures on that. But this would be a way that you could get extra oxygen to your tissues without having to pay for a hyperbaric chamber treatment, right? It's not going to be quite as impressive for certain things, but you're certainly going to give yourself, this is one of the few ways that you can give yourself more oxygen. What's another way? 2 more ways. Exercise. Exercise is going to dramatically increase the amount of oxygen to your tissue and the blood flow. What else? Yes, breathing. And not just deeply, but also fresh air, outside air. If you're inside, open the window. If you're going to exercise, go exercise outside. Very powerful way of getting more oxygen to the tissues. So white blood cells consume as much as 100 times more oxygen when they're fighting an invading organism as when at rest. 100 times. That means they have a very huge demand for oxygen when they are ready to fight. So how can you optimize them for fighting? Giving them more oxygen through exercise or through hydrotherapy. This is one of the reasons why hydrotherapy is so powerful, because you're going to increase the activity of your white blood cells. I showed you this slide also in the first night. They found in the study that the monocytes increased by 75% within 6 hours of treatment with hyperthermia. The neutrophils also increased remarkably and peaked about 3 hours after hyperthermia. Monocytes are some of the key players of our immune system that are needed to fight COVID infections and many other infections. They're actually white blood cells that are like almost helping to control the whole immune response. So this is very powerful. Now, I don't think that your body actually makes that many more white blood cells in that little bit of time. What I think is happening is the white blood cells are sort of hanging out in the body. They often just sort of rest on the insides of blood vessels and things like that. But when you get the hyperthermia, they enter the circulation. And so they can now be measured. You can actually do a blood test that actually measures how this dramatic increase in white blood cells that are being measured in the blood stream. Amazing, amazing stuff. So this is not just theoretically. This has been shown over and over again. I showed you this. Dr. Jackson, who was treating diphtheria, he said, "We never lost a case. We never lost a case." Is that impressive? That's pretty impressive, right? But on our first night, I didn't tell you exactly what he was doing, right? Do you remember that? I only told you that he never lost a case. You want to know what he was doing? All right, here it is. I think there's about 9 or maybe 11 different points. It's simple, not necessarily easy. Simple. Watch this. This is what he did. Hot bath, 98 to 110 degrees, depending on the vitality or age of the person. Obviously, for somebody really old or really young, you would do it at the cooler end of that. Somebody really fit, 20s, 30s, something like that, you would do it at the top end of that. Hot bath, 98 to 110 degrees for 5 to 30 minutes until profuse sweating occurs. Number 2, pack the patient. What does that mean? You're going to put on a bed like this, 2 or 3 wool blankets, and then over the wool blankets, a comforter with a woolen blanket on top, laying them on the bed. Then you're going to put over all of that 1 or 2 linen sheets wet in cool water and left so wet as to simply not drip. And then when the patient comes out and lies on the bed, you're going to wrap them first in those wet sheets, and then you're going to wrap them in all those other comforters and wool blankets. And now they're going to just sit in there, and they're hot because they just came out of the bath. They have that cold sheet by their skin, but they're going to start sweating, okay? So this usually induces sleep. The patient is allowed to nap from 3 to 5 hours. The treatment is for about an hour if the patient does not sleep. Number 3, the windows are open and the room cooled while the patient is packed. When were people getting diphtheria? In the winter, yeah. Most diseases are in the winter, because that's when people are inside, not exercising, have no sunshine, so their vitamin D is low. They're breathing putrid air because they're not opening the windows. They're cold. They don't have good circulation anymore, right? And there's lots of factors why people get sick in the winter. So you open the windows, let the room get cold, and then number 4, the room is heated before the patient's unwrapped. So after the nap, you're going to close the windows, heat up the room so the patient doesn't get chilled, and then unwrap the patient. The patient is rubbed with dry cloths until dry. Chest and throat are wrapped in wet bandages. Number 6, number 7, patient is placed in a bed with a wet cap on his head and something to heat the feet. Number 8, frequent applications of warm cloths, wet or dry, to the extremities. Number 9, quiet environment with only 2 to 3 different persons to care till the danger is past. Number 10, not a particle of food for 3 to 4 days. Have you ever noticed what animals do when they're sick? They stop eating. That's how you know they're sick, right? Otherwise you wouldn't know because they can't tell you, so they stop eating. See, the animals are smarter than humans. Everybody, when a human gets sick, they're like, what? Eat, 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 eat. No. Stop eating. Stop eating actually potentiates your immune function's ability to fight a disease. Number 11, plenty of soft water internally. You don't want to get dehydrated. The opposite of hard. My father-in-law was a physicist and engineer, and he knew a lot about chemistry and about all these different things. And I asked him this question one time. I said, what do you think? Because soft water is a little bit different. I said, did they have the same definitions back then of soft water, and how does that work chemically? And he said, I think it probably wasn't exactly the same definitions back then as it was today. So I'm not talking about taking water from a water softener necessarily. Anyway, just get some good water that's hopefully not too full of minerals and definitely not too full of toxins, right? Number 12, this is what he wrote. So I don't know exactly what he meant. I'm quoting from his article in a magazine called Review and Herald from 1863. So I'm not exactly sure, but this is what he wrote. This is how he documented what he did. Number 12, plenty of fresh atmospheric air. That was what he did. Simple, right? Not necessarily easy. Sounds like a bit of work. Is it worth it rather than dying? Would it be worth it to avoid a trip to the hospital? I think so. Because in the hospital, you're not going to get this kind of treatment. You might not survive the hospital treatment. Yeah, I actually treated a guy one time. We got a patient who had been sick with some kind of a respiratory infection for like almost 3 months, and he had to be off work that whole time. It was really bad. Maybe it was 2 months, two and a half months, something like that. And he was off work that whole time, so he's losing money, right? And he went to the hospital, the clinic, multiple different times. They tried every single antibiotic, antiviral, antifungal, everything that they had, nothing worked. So finally they called us, and they said, what can we do? So he said, well, we're going to do some hydrotherapy on you. So I did hydrotherapy. Because it was a guy, we like to keep the guys treating the guys and the women treating the women. So because he was a man, I did the hydrotherapy on his chest. And I did 2 treatments, I think twice in the one day. And his wife came, and so she watched what I did, and then she started doing it at home. In 3 days, he was better. Is that a lot of work? Yeah, it's some work, but how about 3 days versus 3 months, huh? He tried all the other things for 3 months, it didn't work. 3 days, he was better. Now, it was a particularly virulent virus, so guess what happened? I got it. Was I sick for 3 months? No. I was sick for 2 days. Because guess what I started doing from the very first day? Hot and cold treatments in the shower. I was doing it on myself. I didn't have my wife do the the fomentations on my lungs. I just got in the shower and was doing the cycles myself. I showed you this slide the other day. The sanitarium, this is how they were treating the patients. They had 88% less pneumonia in their Spanish flu patients with an overall 80% less death, with an overall total death rate of 1.3%, whereas the Army had a 6.4%. So very, very, very powerful. And the army camp at that time was considered to have the best treatments available for Spanish flu. And so it doesn't mean that natural therapies are always going to save everybody's life. Okay? We live in a sinful world, and sometimes people are weak. There are very virulent things sometimes that are more virulent for one person than another. We can't always guarantee that we're going to live forever unless we're ready for the second coming of Jesus and he gives us eternal life, right? But we're not going to live indefinitely on this earth. So we're mortal, and we can't always fix every problem, but these treatments are very powerful, more powerful than the medicines, and they don't have the death rates of the medicine because lots of people die from their medicines. And they don't have the side effects of the medicines. And oftentimes the reason why they're not successful is because people don't put in the effort. Here I showed you how they were treating malaria with the hydrotherapy, and the typhoid, I already showed you these. You can even use hydrotherapy for animals. Here's an interesting quote. The horse Parson, this is October 3, 1873, the horse Parson was very sick. We feared he would die. We doctored him as well as we could, putting hot flannel blankets around him. He was relieved after several applications. We learned that hydrotherapy is for animals as well as human beings. So they were doing hydrotherapy fomentations with hot, wet cloths on this horse, and he recovered. So my wife is going to show you how to do various different types of hydrotherapy now. And let me just skip a couple of these that she's going to cover. And I'll show you, let me just talk about the contrast shower, because we're not going to demonstrate that here. So contrast shower is probably one of the easiest ways of doing hydrotherapy if you're not super sick. If you are super sick, it's hard to do it for yourself if you can hardly stand up. So you might need someone else to do something for you. But if you can get up and get in the shower, this is what I do. I mean, if I get sick, which I almost never get sick, but once in a while I do, and usually it's because I did violate some law of health, like staying up too late for too long. I mean, it's literally been years since I was sick. So if you're following health principles, you're not going to get sick as much. But again, we live on a sinful planet. We're not always consistent in what we do, and things are infective sometimes. And so I just get in the shower and do hot and cold. You just alternate hot and cold, hot and cold, hot and cold. End with cold always. 35 minutes hot, 30 to 50 seconds cold. It's not rocket science. You don't have to have a timer there. But that's just to give you a rough idea. Alternate this 3 to 5 times, end with cold. Get in bed and don't get chilled. Okay, that's how you do it. It's amazing for head colds, respiratory infections, sunburns. You would not believe how fast a sunburn will heal with hot and cold shower. And you're thinking, a hot shower, that's going to hurt. Yeah, start out with warm that you can tolerate and work it up until you know you're hotter than you would have been able to tolerate it. And get your skin redder because of don't burn yourself, but get your skin redder because of the hot water than it was from the sunburn. And the next day you won't have any pain. It'll turn to a tan. Or maybe you might get a little bit of peeling if it was really severe. Very, very powerful. 150 years ago, a 19th century health reformer named Ellen White said the following: "Why need anyone be ignorant of God's remedies? Hot water fomentations, and cold and hot compresses. It is important to become familiar with the benefit of what? Dieting in the case of sickness. That means stopping eating. All should have an understanding what to do themselves. They may call upon someone who understands nursing, but everyone should have an intelligent knowledge of the house he lives in. All should understand what to do in the case of sickness." I'm not telling you to force a patient to not eat if they're hungry, okay? But if it's you in question, just stop eating for a while. And if the patient doesn't feel like eating, certainly don't make them eat. So hydrotherapy takes time, takes effort, don't quit, continue past feeling better. If I do get sick, I'll start, like, if I have coughing, let's say I have a disease or lung sickness where I'm coughing, and it's waking me up at night, right? You wake up and start coughing. Guess what I do? I wake up and I go to the shower and take a hot and cold shower. Then I come back to bed and I can go back to sleep for another 2 hours. I wake up in 2 hours coughing again. Guess what I do again? Shower again. I might take 6, 7, 8, 10 showers in a day. You can get over things really quick that way. Don't push it too severely hard with if you're doing lots of showers with the temperature levels, because you can start feeling pretty weak from that extra changes in temperature. But it's really powerful medicine. Don't underestimate it. Go ahead and give it a try, even if you've never done it before. Janelle, it's your turn.
Okay. So I probably ought to grab your...
This one.
I guess. Doesn't have to be, but yeah, that would be great. Thank you. Okay, they're getting you some handouts, so that'll make my job much easier. So we're going to do 3 things, I believe, today. And you need to pick them? A victim? Well, yes, we'll need victims. Pampering. No, she already did it. This is what she did, and she's well. Right?
Is that right?
She did. So that's one of the first things. What we're going to do is I think we'll start with a hot foot bath. And you've got, those are the charcoal handouts. Okay, so not yet, but we don't have to, but thank you. So we're going to start, and I do need a very happy victim for a hot foot bath. Don't just everybody jump up at once, So, but if we could get somebody, okay, good. Marcel, right? Narcisco, never mind. No, I'm terrible, I shouldn't have even tried. Yeah, come on up here.
Did anybody volunteer?
Nobody else has volunteered. And is there anybody who has like a headache or something like that? Otherwise, we might need you actually for the liver fomentations. So we might just move you right along if nobody else is.
You might as well fix all of it.
Yeah. Okay, so I'm going to have you stand right up here or sit here, and I want you to, he's a nurse, you can do this, right? I want you to tell us that you have a headache.
Okay.
You have a headache and you don't feel good, and we are going to do something. What are we going to do? Because he's got this headache, it's a throbbing headache. He's had it ever since he got back from work, and what we're going to do is we're going to move that blood away from his congested head, right? He's got all this throbbing headache. So what we're going to have Francisco do is we're going to have him pull off his socks and shoes.
Just call him Cisco.
Did I call him Francisco? He's just going to laugh at me. Just Cisco. Thank you, Martin. Keep me straight. Like, why is he laughing?
Because he's a happy pig.
Yes.
That's right.
Okay. So far, I've called him about 3 different names. Good. Okay,
You
so
will do it again probably.
Okay.
In a little bit.
so what we're going to do is we're going to have prayer before we start. This is very important. We always pray, right? And we're going to ask the Lord to bless him, and we're going to ask him to bless. This is God's therapy that he told us to do, so we're going to ask for his blessing on it. So let's pray before we start. Dear Heavenly Father, we just thank you so much that we are able to do this therapy today. And we pray that you will please bless, and that you will heal, and that you will help the circulation to be rerouted to help. And we thank you. Amen. All right. And so Now, I'm in somebody's house. We don't have a lot of resources. I don't have a thermometer. I put as hot a water as I could in here, and I would burn him if I popped him in there. So I'm going to cool this down. And so I have my cool water and my ice water. It's pretty hot, actually, isn't it?
Yeah.
And I'm also going to say, Cisco, are you a diabetic?
What should I say, yes or no?
Flip a coin.
Okay.
Say yes, because then, okay, he is a diabetic. And I say, oh, okay, so I want to be super, super careful with, well, I know, but he's a diabetic. It's quite hot. And so if he's a diabetic, then I'm going to have to be careful not to burn him. And so I am going to make the temperature 105 degrees or less. Now, I don't have a thermometer, so that's kind of the pits. So in this situation, I'm just going to, make sure that it is quite cool. I want you to feel that. Do you feel that?
Yeah.
So
It's good.
if I tell a diabetic, see if that's hot enough, or if it's too hot, they'll stick their toe in there and they'll tell me, feels fine to me, because they can't feel. We said that in unison. Pretty impressive. So you're going to have to be super careful not to burn a diabetic. So, check the water on yourself, make sure that it's not going to burn. And I'm going to have you go ahead and pop those feet into there, except you have bigger feet probably than the bucket. I forgot I was going to get a little tiny gal, but
inside?
yep, go ahead. And we're going to have someone start the timer on their phone for 20 minutes. I guess you'll just have to do one on top. Is it too hot?
No, that's
Too
fine.
hot?
I think I can handle it.
You think you can handle it? Yeah, that was cold. I wasn't making it hotter. He's like pulling his feet out. Is it too hot? It's actually quite not hot, but it shows how
That's good.
it shows how when we take our feet and we stick them in somewhere, they actually will feel hot at first. Now I have a hot pot. I can warm that up as it cools down
don't feel it hot
for 20
anymore.
minutes. So he's got a headache. He's congested in his head, probably too much congestion, like he's got his blood vessels dilated. And so what I'm going to do, if I really want to make this all the more effective, is I'm going to take something cool and I'm going to put it around his neck. All right? Got some towels in here. I'm going to wring him out so I don't get him really, really wet. I'm so glad you volunteered. So if I put a cool cloth on his head or his neck, then I am encouraging the blood away from here to here. All right? Mom, you look terrified. The lady who did this to us as children. So we're going to just put this on his head. That's going to kind of cool things down. Sorry about your hair. It'll look great afterwards too. So we're helping to cool him down up here, which is going to do what? It's going to constrict here, and we have just dilated down there. So that is going to, now if you're a woman and you have, that time of the month, this is a super, super good way to help pull congestion away from the pelvic organs. You could even put something cold here or cool over the pelvic organs and the warmth down on the feet. And that helps a lot. It can really help.
Did you say for 20 minutes for that process?
20 minutes. Yep, 20 minutes. And so I don't want to make you all wet and you'll go home cold, but at any rate, actually I'm going to just,
That's fine.
okay, there you go. Feels good, he says. He's a great patient. Kim?
Is this effective on like a migraine?
Yes. Pounding, headache. The migraine, they're going to have constriction and then dilation. And that's what we're combating here. Yeah. We're trying to help with. If a person has a migraine, I'm probably going to be putting a little magnesium sulfate, which is just Epsom salts, under their tongue. And I'm going to probably put some in the water as well,
If they have what?
a migraine.
Oh.
Yeah, just because the,
Or the magnesium chloride.
right. Yes, a diabetic could, yeah.
Magnesium
Now
is
you
very
just-
helpful for diabetes. It helps
Yeah.
the blood sugar to get into the cells.
Yeah. You were kind of like, why? Is there something that you know about that that you've heard otherwise? Because I don't want to, I mean, I'm learning stuff all the time.
Well, I was, I think I told you I was very ill for a long time, and I finally went to somebody similar to you, and he said, do this one time, but don't ever do it again. And he had me get in a whole bath of Epsom salts and
Oh, okay.
something else, but he said, with you having blood sugar issues, don't ever do this again. But I mean, it was hot as like sand.
Yeah, I'm not sure. Oh, probably just because of the heat. And they were probably worried about the heat
He
with
was
the
worried about
diabetes.
the Epsom salts.
Yeah, I'm not sure. I'm
But
not
he
sure
might have
why.
been incorrect.
Yeah, because the magnesium is going to help to relax the vessels, and it can really help the nerves as well in a situation. And it also, what we learned is the magnesium can block it helps to kind of mitigate if you get an excitotoxin overload, which is often why people are heading into migraines.
Maybe that's,
So-
he was afraid I would detox too quickly,
Too
he
much,
said. That's what he
perhaps.
said to me.
Yeah, so, okay, are you timing? For how long?
Yeah, we have been
How do you feel? Are you comfortable?
7 minutes.
Okay, so now the next thing is, Martin is telling me I have to move along. So the next thing we want to look at while he is in there soaking is I need a volunteer to do a neck compress. It's called a heating compress. Doesn't that sound delightful? I see. Okay, come on up. Okay, so I'm so bad with names. A very nice lady in this church. Robin, thank you, donated this to the cause. So come on up, and we're gonna actually, well, I guess you don't have to have a chair. We'll send you back to your seat in a little bit. But this is what we started with, is 100% cotton, very nice little thing, and I cut it up. And I cut it up into pieces of just a strip that can go around the neck. So she's tiny, I'm gonna use the tiniest one here. And I'm just gonna dip it in and get it wet.
Does it have to be cotton?
It doesn't have to be cotton. If it's something like cotton poly, it would probably work, but cotton's usually the best. It holds on to the water. Sometimes the poly will, get rid of the water too quick. So we're gonna get this nice and wet. And this is what we're doing if somebody has a sore throat, all right?
And even though this is called a heating compress,
It's
we're putting
cold. It sounded nice, didn't it? I'm going to actually have you hold your hair up, and I am going to take this and I'm going to wrap it around her neck. All right? So what we're doing is we are taking her circulation and we are making her vessels constrict, making her skin constrict. What am I doing here? And then I'm going to take something like a warm sock. Thank you, Fred. For a nice warm woolen type sock. Now this is not 100% woolen sock, but it'll work. Fred was trying to give me another one that was better, but bigger, and it would have been scratchier. But anyways, we ended up with this one.
Has that one been put in hot water, or you just room?
This one is this has not been put into hot water. This is just a dry sock that covers up that cold, wet rag. Okay, you want a nice safety pin to do that with. We couldn't find any big safety pins, so we just got little safety pins. Make sure when you're putting it together, put your fingers behind it so you poke yourself, not the patient. That's very polite to poke yourself, not the patient. And so anyways, now that's all we're going to do with her is we're just going to send her off to bed. Not really, but at any rate. And again, you have prayer before and to help. I'm supposed to tell them. So the reason it's a heating compress is because your body is heating it up, okay? So we just constricted all the vessels. We sent the blood into the tonsil area, the throat area inside, and then the body starts warming that up, and what it does is it kind of causes a reflex dilation then. So she's going to wake up in a couple hours, and that's going to be completely dry. Her body will have dried it. And so the cotton will be dry, and the wool is good because it kind of loses the moisture, right? It wicks it away.
If you take it off in about an hour, you'll actually see a red band there, like you were showering with heat, from the heat. The body's dilating those vessels.
But you want to wait till it dries out and then do it again. You could do that 3 times in one night. Just let it dry. When you wake up, put another one on, and then you have just turned your skin into a pump, and you have exchanged the blood back and forth, back and forth. How are you doing, Cisco? I called you the right name.
Yeah,
How many minutes are we?
kind of.
It's kind of, he says, not the right name. Oh dear. So
What
how
is that for?
how many minutes?
What is the compress?
Sore throat.
Sore throat.
Sore throat. Yep, sore throat. He's holding his heat very well. Good. How many minutes has it been? 10 minutes left?
We have been 30 minutes in, about.
Good. 13? Okay, so
about
he's
8,
got
10
about 8
minutes
more
left.
minutes. Okay, so
to 10.
when I warm this up for him, I am going to have him remove his feet from the bucket, like kind of perch your, remove it, not all the way, just lift them up, and then I'm going to pour against the side, so I'm not burning him, right? I'm going to mix the water so he doesn't get into a pocket of hot water and burn himself, and I'm going to say, okay, go ahead and put it back down.
It's a little bit warmer.
A little bit warmer. I'm going to have you do it one more time. Good thing he's got strong muscles in his belly. Okay, good. A little maybe warmer. And, okay, so good. So now what we're going to do is we're going to do a fomentation while he's finishing up. So we're going to start a fomentation. So I need a guy who will let me do either fomentations on his back or on his liver. I'm not going to ask you. He's already going, no, I don't want anybody who doesn't want to do it. And if you don't want to do it, if we can't find a guy, then we'll just do it on we'll do a lady's leg. How's that? You know, no big deal. What's that? Yeah. Well, that's true, but I mean, we went to all the. Hey, all right, Fred. So, yes, actually, thank you. Yes, they made handouts. I think we have about 20 handouts, and these are so maybe one per family, and make sure that we've got enough to go around, and if not, then we'll pull yours. Yeah. So, yeah, thank you, Fred. So, I think. What you want to ask a person that you're doing fomentations on, the kind of the big things are you in congestive heart failure? You know, have you ever had a heart attack? Things like this, because you don't want to overheat somebody.
Don't worry about
Oh, great. Well, so, but that's the question. Do you have like heart failure or things, you know, have you had a heart attack before, things like that? And Fred has not, praise the Lord. So, and then again, you're concerned, are they diabetic? In other words, do they have problems feeling things?
How long am I going to be here?
I'm guessing that you'll be here about a half an hour.
Then I'm going to go
Do you
downstairs
not, wait a
first.
minute, just a second.
I'll be right back up.
Okay. I'm wondering, you're what? You want to continue lecturing? Okay. Well, what we could do is come back and finish this if it's going to be too long. And you can start the charcoal lecture and then. Yeah. It would work, except I won't have a mic. Okay, okay. Super careful with. Like, I've done fever baths on people who are like over 80 and with heart problems. But I don't know, you know.
You want to monitor the
wanna-
heart rate
Yeah,
and the breathing rate.
yeah, I would say that
And-
you don't want to jump into something like that unless you have, you know, backup and you've done it a few times. And so, yeah, I would say for most people, I wouldn't just jump into doing a fever bath on somebody who's over 80 and has had a heart attack.
What
That's-
about hypertension? The same?
I would say hypertension would be fine, because you take somebody with hypertension and you put them in a nice warm bath,
It's going to lower their
they're
pressure.
gonna have a nice low blood pressure, unless the reason they have hypertension is because they have an occlusion in their vessels and their body is forcing blood by, and then you just drop their blood pressure and now they don't get any perfusion to their brain, and then you get to call 911. So, I mean, I'm not trying to scare you, but that's, you know, so you have to kind of think through what you're doing before you just kind of like jump into it. If somebody has like stenosis and that's why they have high blood pressure, and then you go and put them in a nice something hot, you can cause problems. So you do want to know what's going on with the person, and you don't want to, there are conditions where you don't want to drop somebody's blood pressure, because then they're going to stop thinking, you know.
Okay, we're going to go ahead and start this next segment, and we're going to try to see if we can stagger these things so that we're moving forward, because we still have another demonstration that we're going to do downstairs. So we're talking now about a black powder, an explosive natural remedy. I told you on the paper it was going to be explosive natural remedy. What is that? What does that mean? Well, you're going to find out in a second. Pliny, the great Roman scientist, said it is only when ignited and quenched that charcoal itself acquires its characteristic powers, and only when it seems to have perished that it becomes endowed with greater virtue. That sounds almost like a spiritual lesson, right? Like when we die to self, we can be endowed with greater virtue from God. Well, that's what happens with charcoal. The oldest recorded use of charcoal is 1750 BC. The Egyptians and Sumerians produced charcoal for the reduction of copper, tin, and zinc ores for the manufacture of bronze. In the 1500 BC, Egyptian medical uses included absorbing the unpleasant odors of putrefying sores. Phoenician trading ships in 450 BC preserved drinking water in charred wooden barrels. Hindu documents around the same time refer to use of sand and charcoal filters to purify drinking water, and Hippocrates around 400 BC records medical uses including anthrax, vertigo, chlorosis, and epilepsy. In the 2nd century, Claudius Galen, a famous Roman physician, wrote over 500 medical statements, many referring to the use of charcoal for the treatment of a wide range of diseases. And the Chinese used charcoal in 12th century fireworks and gunpowder, which is why I call it an explosive natural remedy. Charcoal has this amazing amount of surface area. 1 cubic centimeter, that's about this big, has a surface area of over 1,000 meters. A meter is over 3 feet. 1 quart of charcoal will adsorb 80 quarts of ammonia gas. It's not really classified as a drug or mineral. It's indigestible. Its adsorptive capability comes from capillary action, electrostatic, and other undefined properties. They're not even sure exactly how it works, but it works. Let's define, before we talk more about what charcoal is, let's define what it is not. Charcoal is not burned toast. People like to joke, especially if they know you use charcoal. They'll say, ah, ha, ha, we burned the toast. Now you're going to get your charcoal for the day. No, burned toast is not charcoal. There are substances that are normally consumed in the charcoal making process that are still in the toast. You have the toast that contains superheated proteins, fats, and carbohydrates, which are chemically changed but not completely turned into carbon. You have to turn it all into carbon before it's charcoal. So burned toast is carcinogenic. So are other burned foods. Don't eat burned foods. So charcoal is not any burned food. It's not ash. It's not the gray stuff in your fireplace. It's the light pieces of crispy black stuff. Charcoal is not charcoal briquettes. They contain charcoal, but they also have adhesives and petroleum products to help them ignite easily. You want to use it? Yeah, I can pause for a second.
Okay. Sorry. Thanks. Sorry. I'm killing your ear. Hopefully we won't make a great squeal. Okay, so he's been in here 20 minutes now. So what I'm gonna do is get ready to dry his feet. And before I do that, I am gonna rinse off his feet with ice water. Now, I could just take it and plunge it in this ice bucket, but I'm not gonna do that because I wanna use this ice on somebody else too, right? So I'm just gonna pour over his feet. So I'm gonna have him lift one foot up. And I'm gonna just pour the ice over it 1 foot at a time. Isn't that nice of me? Boy, that was like a nerve response. Okay, one, and then I'm gonna let him pop that foot out, and I'm just gonna kind of dry it off. He doesn't even want to put his foot back in there. Yeah, and actually this is, a healthy, young man here, and imagine how that's gonna hit somebody else. And that's kind of amazing how it makes his whole foot like shake. So it's kind of rough on people when you do that. So be sensitive to them if they're not used to that. Okay, so we've got that all nice and dried off. And so the next thing that would be perfect for him to do is to go take a nap for 20 minutes, right? Because we just raised the temperature. We've got a little more white blood cells circulating now. So if you could go take a nap for 20 minutes, then we could capitalize on that.
And I have my old socks too.
Yeah, he's like, put my old socks back
No,
on.
my old.
Oh, your wool socks. Are those wool socks? Good, good. And so we just turned that into a pump. Now, actually, here's the thing. If he really had a migraine, I might not end with something that intense, because I just pulled his circulation away, and that's what I wanted to do. So I might just, either do a very cool, just to kind of close the heat in, or I might not do it at all. Just think about why you're doing it. We're doing it because he's got a congestion up here. So do we really want to pump it back? So I might just have him go lay down and skip that last step. We always like to end on the end because we're like, oh, one more pump. But if I've got somebody with a migraine, I might just have them go lay down and relax.
And not do the ice water?
Right, not do the ice water.
How much
Thank you. I owe you. I appreciate it.
Thank
It
you.
seems to me that without exception, this should be ladies on ladies and men on men.
That is our policy that we follow. Men give men treatments and ladies give ladies treatments. And that is one thing, when you are giving a treatment, obviously I would probably give a male a foot bath without a problem. I'm not gonna give him a massage. I'm not gonna do like, where I'm in the room with him alone doing, anyways. But that is something to keep in mind. I always tell people, before you go treat your patients, give yourself the what do you call it? The mirror check. Bend down in front of the mirror. You don't need to display yourself. Wear modest clothing when you're treating people. It's just respectful. It is respectful. So, all right.
Are you going to start
So-
that before I go back to this? Or?
Well, if you want to start talking for a little while, and we'll get Fred settled,
Okay.
and then, yeah.
All right, so we're going to talk
Yep, I'm
about
gonna have you lay face down.
we're going to talk about activated charcoal versus regular charcoal. Activated charcoal, this is not just a sales technique to tell you that it's somehow better. Activated charcoal actually is more effective. It has a greater oxygen, well, there's extra oxygen that's introduced in the process of making the charcoal at a specific point in the burn that helps to hollow out more surface area than charcoal that's not activated. And so it just is able to absorb about 2 to 5 times better than non-activated charcoal. It doesn't mean that the non-activated charcoal is bad or that it might not work. You just might have to use more of it. So if it's not available, if all you can do is pull a piece of charcoal out of your fire at your campfire while you're camping, do that. If that's all you have, if you don't have activated charcoal. Somebody gets a snake bite and you're camping, you better have charcoal. Well, first of all, charcoal is a very important thing to keep in a first aid kit. If you're a mother, if you're a family, you need to have charcoal around for all occasions. We'll talk about some other reasons why in a minute. Charcoal is used in inks and dyes. It's used to whiten table sugar, yes. It's used to clean up toxic spills for industrial and military gas masks, to scrub carbon dioxide out of the air in nuclear submarines, in cooking oil refinement, by NASA in the International Space Station for air and water purification, as a soil sweetener in HEPA filters and water filters, in art in the manufacture of silk, by the cosmetic industry in fish aquariums, Olympic-sized pools, to give color to licorice and some jelly beans, and for gold recovery. It's used for all kinds of things in industry. In medical uses, it's also used for poisonings and drug overdoses. Every emergency room, as far as I know, in the country has got charcoal, activated charcoal available in the emergency room for a potential poisoning. It's very, very important in medical use. It's used to disinfect and deodorize wounds. It's used to filter toxins from the blood and liver and kidney disease. It's used to purify blood transfusions. It's used to reduce odor for ostomy patients. It's used in dysentery, diarrhea, upset stomach, colic, and snake and spider and insect bites, for intestinal gas. In clinical trials, the syrup of ipecac, which is what they used to give in the emergency room or at home if you had a child that swallowed a poison, you'd give them ipecac, which is what they call an emetic. It means it makes them vomit. It only would get rid of about 25 to 35% of the poison, while charcoal gets rid of 50 to 75. And I would say that's actually underestimated, because charcoal will probably get rid of most of it if you take it quick enough. In fact, nowadays, I don't think they even use ipecac. I don't know if you can even buy it. Yeah, it causes problems. So charcoal is the thing. If you call poison control, they'll tell you to take charcoal. Doesn't matter what you've taken. It can adsorb, and I'm not saying that wrong. It is adsorb, which is different than absorb. Absorb is what these towels are doing. They're absorbing water. It's a physical soaking up of the water. Adsorb is what charcoal does, which is a chemical reaction that chemically binds with the toxin and deactivates it. So it's known to adsorb to over 4,000 different substances. So if in doubt, give charcoal. If somebody's drank some poison, or if the kid's there with a bottle of poison and you don't know if they've drank it or not, give it to them. It's not going to hurt anything. The main kinds of substances that it does not absorb well are petroleum-based substances like gasoline, diesel, things like that. And that's because charcoal is also petroleum-based products are carbon-based. Charcoal is pure carbon. So they're so similar that they don't tend to react well together. But other things that are dissimilar from charcoal adsorb very well. You ready?
So what would you do if the person swallows diesel?
I'm sure that charcoal, you could try some charcoal. It's not going to absorb a lot of it, but diesel fortunately tastes bad, and so a child is not likely to drink too much diesel. or gasoline. Yeah.
Okay, so now we have a happy little person who volunteered here, so thank you, Fred. So what I want to do is.
Is your mic on?
Probably not. Okay, there we go. So what I'm going to do is just kind of, first of all, tell you a little bit that what we're going to do is we're going to do a fomentation on Fred's back while using only towels. And I'm doing that because guess what? Not everybody has fomentation pads. Saya sent us the fomentation pads, and I'm going to show them to you. If you want, you can. Does anybody want to? Can you all see okay? Because you can come and sit up here on the front row if you want to. But a fomentation pad usually it has some felt. It's felt or wool in there. And at first I was kind of like, I was used to doing fomentations with towels, and I was like, what do I do with this? You know, I can't fold it how I want to, and this kind of stuff. But I tell you what, once you get used to these, you really don't want to go back. But we're going to go and we're going to do it with towels because that's just more readily available. At one point we had a lady who came back to our church, and she had been somewhere where they had a really fancy hydrotherapy department, and when she came back she said, I can't do it because I don't have that hydrotherapy department. And so we were like, well, do you want to try this? You want to try that? And she was just like, no, you don't have a hydrotherapy department. So we made the decision at our retreat that we would not have a hydrotherapy department. We might kind of regret that now. But we just have the same thing as people have at home, although I have migrated to these. And I do have some really nice wool covers. And so I don't even have a wool cover right now, which is going to hamper me a lot. But some people just don't. They don't have wool blankets, but they probably have towels. That's the first thing they're going to have. And so what you need is and most people have microwaves nowadays. They have microwaves before they have stoves, actually, you know.
What's the name of the towel that you said, the first name?
It's just a fomentation pad. You can find it in like rehab, like for physical therapists will use it.
Okay.
So one of the main.
You can find them on Amazon.
Yeah, Amazon has them. They're not as nice as hers, though. So sometimes if you go to like hydrotherapy, like my mom went to a hydrotherapy class one time at Andrews University and came back with these fabulous supplies of wool covering blankets and different things. And that's where I think I've got some of mine. And then a lot of the other ones of ours, actually, when they shut down the Walla Walla General, that's where I got most of my fomentation pads from, sadly enough. Okay, so what you want to do is you have to be really careful not to burn the patient. That's kind of like rule number one, and that's important. I mean, I know seasoned, physical therapists that I would trust with my life who have burned patients before. And so you've got to listen to your patient. You've got to be super careful and try, don't burn your patients. So I'm going to this is one of the ways you're going to not burn your patient is you're going to put a dry towel against their skin. This is really important. Every time I place another fomentation, I'm putting the dry towel, it has to be out. I try to conserve towels by moving the towel twice, right? Otherwise, I have to use a different towel every time, and I have so much laundry at the end. And that's one thing, that's why I think people don't do fomentations a lot. It's a lot of work. It's a huge amount of work. You have a huge pile of laundry afterwards, but the more you do it, especially on the same person, the more efficient you become. The first time, I feel like I'm running around like a chicken with my head cut off because it's just like, oh yeah, this, that. But then the second time, and the third time, we've like got this down and we're efficient. We start seeing how few towels we can use and this kind of stuff. So I would put this on here. I'm going to, one thing I like to do is I put warmth on the feet. Now, they'll do it with, basins and stuff. It's hard when they're face down to do that. And also, you can do it with just like a thermophore. Yeah. Okay, so I have this here, and I took my towels.
What's a
A thermophore is an electric blanket that you,
It's a little hot pad for feet, yeah, or
That-
for hydrotherapy.
that has a kind of a felt cover, and it helps you to sweat. So your sweat creates the water that then it uses to kind of give you a hot fomentation. So, so what I'm going to do with this is I'm going to open it, whenever I use a microwave, I'm going to open it fully up before I put it on the patient, and I am going to touch it because the microwave heats differently. It heats the center hotter than it heats the outside. Like when I was warming these earlier, I was like, oh, piece of cake. We're going to actually do this for pain, okay? Back pain.
Is that dry or?
This is wet.
It's wet.
This is wet.
Do not put a dry towel in the microwave. You will make a fire.
I've done that.
And what I mean by dry towel, most people aren't going to just put a straight dry towel in there, but if you got to make sure the towel is completely wet. If there's a dry spot in the center, you can start that thing burning in the dry spot in the
Fred,
microwave.
do you have back pain?
We've done it,
I
so
think Fred's asleep.
we've done it, so we know.
Do you have back pain? Do you have back pain?
Am I supposed to?
Well, I just wondered if you did. Am I supposed to, he says. Okay, so what I did today, since I don't have my nice wool cover, I just put a plastic bag down to kind of try and hold in the heat, and I put a blanket over the top. All right, and then I'm going to have somebody time 5 minutes, and he's going to talk.
All right, we're going to talk more about charcoal now.
I'm going to interrupt for just a second. Fred, I'm going to be asking, Fred, is that too hot?
No, it's too cold.
It's too cold, he says, which I would expect right now. At first, it is going to be cool, but I need to ask the patient, is it too hot? And if it is, let me know. And guess what? I just put my hand underneath here, and I'm feeling. And all you do is if he does tell me, I feel a hot spot, I immediately put my hand underneath, and I put my hand on that hot spot. And I hold it off his skin for just a few seconds. And when I feel it cool, I can drop it back down. That's how you do that.
All right. Anecdotal medical uses include food poisoning, jaundice, ulcers, hepatitis, gallstones, bacterial infections, prostatic hypertrophy, BPH. So that one, I'll give a little explanation. I didn't the other night, but that one would be done. We're not into enemas. I know that some
Well,
health retreats are into enemas, but
yeah,
Not even
we're not
water,
into
are they?
that,
not yet.
especially not colonics. Yes. Charcoal pills. Well, for this particular usage, we are going to do a small volume enema, okay? Not a colonic, but you take about a half cup of warm water and put about a tablespoon of charcoal in it. Use an enema bottle and put it in the rectum. It's right next to the prostate. That's where the doctor feels the prostate to feel for enlargement, and so then the person would hold it in over the toilet in case they let some out, until the water is absorbed, which happens pretty rapidly because the intestine absorbs the water, and then it's there beside the prostate until the next bowel movement. So that can reduce the swelling of the prostate dramatically and help keep urine flow working good without a drug. Yes?
I meant more like poisoning, drug overdose,
Yes, I'm going to talk a little bit more about how you do it in a little bit for the poisonings and stuff. So you can use it for poison ivy, for whitening the teeth, yes, something black for whitening the teeth, bad breath, microdialysis of the blood. It can be used for tetanus, tuberculosis, sprains, anthrax, sore throat, even allergic reactions. Apparently, peanut reactions can have, apparently it's because of probably some toxin which charcoal can absorb. Now, for liability reasons, you know, if somebody's allergic to peanuts and there's an EpiPen available, you would probably want to use that. But if there's nothing else available and somebody's going into anaphylaxis from eating peanuts or anything else, it might be reasonable to try some charcoal. There's a story of benzene poisoning. A certified pipe welder from Columbus, Ohio in 1994 came to work one day. He thought it was raining, and suddenly he was whisked away to a little building by men in chemical suits. And it turns out somebody in the factory had turned a wrong valve in part of the factory about a half mile down the road, and that had opened up some kind of an outlet for benzene that was spraying up into the air 200 feet in the air and coming down like rain. If you know anything about benzene, it's one of the most toxic substances known, and it's coming down on all these men. Well, there were 17 men that were exposed, besides him, 17 others. And as you can imagine, and then the company went and just dismissed them all. They fired them because they didn't want to deal with the fallout. Well, that made more fallout because then there was a lawsuit, etc. And he had been there in that little building with these other 17 guys, and then somehow he kind of got dropped through the cracks because he didn't get called for the lawsuit right away like the others did. But on his way home, he met a friend, and the friend heard what had happened, and the friend gave him a whole big bag of charcoal and said, "Eat this." So he did. Later on, he got summoned for the court thing, and the lawyers were kind of like, "Who are you?" Because he wasn't originally in there, and then everybody vouched, yeah, he was there too, but he hadn't gotten all the testing, so they sent him off for testing like all the other guys had. Comes back, no benzene in his body. All the other men had benzene, high levels of benzene in their bodies. By this time, 2 of the men were blind already, 4 were on dialysis, and all of them were being treated by a neurological psychiatrist for all the good that's going to do. And he apparently had no sequela. So it tells you a little bit about the power of charcoal. Now, it can be used for mushroom poisoning. If you happen to start to learn to find wild mushrooms, you better keep this in mind. I would suggest eating it. If you're new to it and you don't know the identification very much and you think you got the right mushroom, you better fry them up and then eat them and then take some charcoal immediately too, right? You don't want mushroom poisoning because mushroom poisoning can actually kill you a couple days later from liver failure. But it can absorb that. It can be used for snake bites. I told you the other night that 100 times the lethal dose of cobra poison could be injected into animals after it was mixed with charcoal with no effect. So the charcoal is totally inactivating the poison. It can be used in it's been demonstrated that it can adsorb carcinogens in animal experiments. I know one missionary whose parents were medical missionaries in South America, and he said that they never lost a case of snake bite where the patient applied the patient or somebody helping the patient applied the charcoal soon enough and often enough. And so it can actually absorb the poison, the snake bite venom, right through the skin. So we'll talk about that in a minute. Janelle has something more to say.
Okay, so about that. Is it uncomfortable? No. Okay. He's like ready to go. All right, so now the first one he's telling me.
Turn on your mic.
First one he's telling me that is not hot. I can feel it was warm, but he's like, that's not hot enough, not hot enough. And so anyways, the second one, was that hot enough? Okay, good. So I'm going to take this off, leaving that one towel on him just a little longer, and I'm going to pop this. Well, I'm probably only going to do 2 cycles for him just because you guys have something else to do besides watch this. But at any rate, I'm going to get this started so that it's hot when I need it. Well, it's going to vary based on that seems to be a fairly good microwave. So I put it for 2 minutes and 22 seconds. So I was too lazy to move my finger around.
Some of the microwaves we've used have needed 4 or 5 minutes.
Yeah, some of them I have to put them in for 5 minutes. So now notice we've already got a bit of a pink response here. I don't usually just leave it open here like this, but I want you to see this. If you need to come forward, come and see. Now this is, what I like about this red is I push my finger on it, it blanches, and then the color comes back. I haven't burned my patient, right? If it stays red, I'm burning my patient, right? I blanched it and it's blanching. So good, that's how we want it.
You want it to get pink.
Yeah, so now I just put cold on. Sorry, I should have given a little pre-warning. And he didn't scream. I had one lady that would like scream every time I did it and then start laughing hilariously. We just laughed all the way through her things. And so I'm gonna do this for 1 minute. And guess what? It heats it up really fast. So you go like this, woohoo, you know? And he's going, right? And so that was one, and I could get another one ready while that one is warming up. And that's okay, he says. Oh, come on. You don't want to.
They get the idea.
Yeah, okay, so then I do another one, flip it, and then it's back to the hot. So I've got my hot one that I just pulled out. It's probably not going to feel hot enough to Fred, but we're at first, but I don't want to get it too hot initially. So I just moved that over. If you leave the wet one on, if you leave the wet one on, you're actually much more prone to burn the patient because it will transmit the heat a lot faster. And you'll just see that it loses control. That's pretty hot. And so I'm kind of holding it up to cool it down a little bit first. Okay, how does that feel, Fred? How does that feel, Fred?
Can't feel anything yet.
Can't feel a thing. That's just what we need. No, not really. But it'll get warm here soon, and I know it will because I can feel that heat on it. And pretty soon he's going to tell me, okay, hot spot here, hot spot there, and I'm going to be lifting it up because this is a warm one.
Okay, so I think I told you
5 minutes.
I think I told you that I used to catch snakes in Africa, and I've done quite a bit of study on snake bites and snake venom. And so if you remember back when they used to tell you you're supposed to have this little snake bite kit, and you could buy these snake bite kits with a razor blade and stuff like that in there, and you're supposed to cut where the snake thing. Don't do that. That's not recommended anymore, okay? A long time ago, that was no longer recommended. Don't cut. If you're a non-medical professional, you could cut things that you shouldn't be cutting. If you are a medical professional, you're still potentially opening up for additional infection because you're opening up the skin. And the last reason is if you actually lacerate the area where there's still some venom, it's going to make the venom absorb faster. So it's not really helping. You don't want to cut. What you want to do is you want to put a charcoal poultice on that snake bite immediately. And I know you have snakes around here because I've seen them. My wife used to live in Indiana, and so when we were dating, we came out here and went to a park a little further north than here, and we saw a rattlesnake there. And so you want to be prepared for these kinds of emergencies. And how are you going to put charcoal in there if you don't have it with you? And then, of course, there are some other treatments for snake bites. If it's a neurotoxin, then you would put a tourniquet. And a tourniquet is a very tight tourniquet, okay? So this is, if you put on a tourniquet, it better be a tourniquet. Not like blood pressure cuff tight. You want to cut off the arterial circulation. That's what a tourniquet does. It's not just cutting off the venous circulation, because you don't want the blood coming in the limb and not being able to go out, which is what happens if you don't make it tight enough to cut off the arterial circulation. Now, you're not going to put a tourniquet on a snake bite that is a hemotoxic snake bite, okay? Which is what a rattlesnake bite is. Hemotoxic snake bites cause massive swelling and tissue damage. If you put a tourniquet on there, you're almost going to guarantee they're going to lose the limb. So you only use it for a neurotoxic snake bite, which are very, very toxic. They're going to kill the patient by paralyzing their nervous system, and you want to slow down that poison from getting to their system. It doesn't cause the massive swelling that other snake bites cause, but it's more dangerous. The only neurotoxic snake in America is the coral snake. Okay, so you don't have those here. And so you're not going to use a tourniquet around here for a snake bite. So that's extra credit. because that's not in my lecture. I just thought I'd tell you that since we're talking about snake bites. We talked about the other night how cholesterol can be, how charcoal can be used for cholesterol reduction. And it's very effective for cholesterol reduction. So it's one of those things that I would call a natural cholesterol lowering pill, along with the niacin, which I also talked about the other night. Vitamin B3. Well, 150 years ago, a 19th century health reformer named Ellen White said the following: "One of the most beneficial remedies is pulverized charcoal placed in a bag and used in fomentations. This is a most successful remedy. If wet in smartweed boiled, it is still better." Now, I've tried to figure out what smartweed was, and unfortunately, there's at least about a dozen different plants that answer to the name of smartweed nowadays, so I'm not sure what she meant. But anyway, she says, "This is a most successful remedy. I have ordered this in cases where the sick were suffering great pain when it was been confided to me by the physician that he thought it was the last before the close of life. These were patients that were just about to die." Okay. "Then I suggested the charcoal. The patient slept and the turning point came and recovery was the result." Amazing. Okay, I think she needs to talk for a little bit and then I'll
Yeah.
finish this quote.
Yeah, so we're gonna just go in the next one. We're actually gonna finish with this one because this is not the most comfortable position for Fred, so we just learned something about Fred. The next time we give Fred the fomentation in about 12 hours, we're gonna have Fred flip on his back, right? So that's just, you're gonna learn your patient. So we're gonna end with cold. So I have my cold. We end with our 1 minute of cold. Okay, here we go, Fred. And look at this. We have this nice red blanching. Then the red comes back. We haven't burned Fred. Woo! Are you all right? We're just going to kind of leave that on him for a minute. And then we're going to flip it because it's cooler on the top. Okay, are you all right? He's not all right. Okay.
It's a relative term.
Yes. And actually, fomentations should not be entirely comfortable, quite frankly. If you're doing them right, they need to be warm, and then they need to be cold. And unless the person just thinks that's great fun, they're going to be like, oh, that was not like my biggest picnic of the day. Okay, so, all right. Yes, let's get you dried off. And can you see that? Can everybody see that? And so, yeah, that's the thing. We got a nice warm, and I just put that on like this, right? So we dry you off, and so now what we want Fred to do, if this was, something we were doing, is we want Fred to go lay down. Huh? And I'm not right now. I'm just telling you, this is what we would have you do, is we would have you lay down, go rest for at least 20 minutes. So Fred, you're good. You can get up.
Hard to do that driving, you know that.
Yes, he's like, I gotta go. I got things to do. So anyways, look at how he's healed, so, but anyways.
All right, so
Thank
we've
you,
got
Fred.
to finish this quote. It said, "To students, when injured with bruised hands and suffering with inflammation, I have prescribed this simple remedy with perfect success. The poison of inflammation was overcome." Notice she calls it a poison. "And the pain removed. The healing went on rapidly. The most severe inflammation of the eyes will be relieved by a poultice of charcoal, put in a bag and dipped in hot or cold water as will best suit the case. This works like a charm. I expect you will laugh at this." She's writing this to a doctor. "But if I could give this remedy some outlandish name that no one knew but myself, it would have greater influence. But Dr. Kellogg, many things have been open before me that no one but myself is any the wiser for in regard to the management of sickness and disease, the effect of the use of drug medications, the thousands in our work who might have lived had they not sent for the physician and had let nature work the recovery herself. But the simplest remedies may assist nature and leave no baleful effects after their use." And I can tell you, inflammation can be pulled out in amazing ways. We had a patient at the assisted living facility one time that had diabetic foot ulcers, and we didn't have any choice because they had the visiting nurses assigned. So these weren't nurses that worked for us, and we didn't have any control over what they were doing. And the doctor had prescribed stuff, and so we had to let them do their thing. And they came and did their thing every day for a year. And it wasn't getting any better. And they were using the greatest, latest, newfangled drug medication that was costing $500 a month. And so they finally discharged him from their services for failure to improve. And we were like, good. Now we'll give it a try. So we did papaya poultices and charcoal poultices. And in 5 weeks, the thing was closed up. After they worked on it for a year. We had a couple of cases where, did you want to say something else here? Okay.
I just wanted to check and see how is our neck warming doing? Is it dried already, or how does it still wet? Is it still wet? It's still wet. Okay, we're just going to let her wear it for a while longer. But I know, but she won't. She's going to give it back. I'm going to give you your other sock. In the meantime, I was like, that's why I was checking it. I was like, don't leave till I check your sock. But anyways, yeah. So, but just keep in mind, it helps if I have 3 of these left right now. And if you're ready for this, you just get your, Fred, oh dear, he just ran off on me. Okay, so if you get your sock ready with your safety pin your cotton cloth to it, and you are just ready. Stick that in your drawer, and you are just ready. And when you feel crummy, you don't have to let's see, where's this, where's that? You're just ready with it, and it's ready to go. And it really helps, right? Appa, you did it, and she's already better. And you'll probably do it again tonight, right? Because it's just, and I know anytime we were little and we complained that we had a sore throat, we ended up with a sock around our neck. That was just it's got something to do, and we survived. So, all right. So here's this, and I'm going to give you some other stuff too.
Okay, so we actually had a couple of interesting dramatic cases with charcoal. We've used it a lot, but I'll tell you a couple of stories that really stuck out. One time we went on a kind of a trip down to see some relatives in Arizona and up around through Colorado and back home like that. And so we got to my sister's place in Arizona, and her daughter was sick, and she was wondering whether or not she's going to have to take her to the emergency room. And she had a lung issue, and it was getting pretty bad. And so we said, have you tried a charcoal poultice? No, she hadn't tried that. Well, we're like, well, we've got charcoal in the car. Let's try some. So we put a poultice on her chest, and she was dramatically improved by it in just a very short period of time. Well, we went on and went to another relative's house, aunt and uncle, and then I was supposed to go to my cousin's house, who was the son of that aunt and uncle. So we were at the aunt and uncle's house for a couple of days, and suddenly my cousin called and said, we were supposed to go to his house the next day. He said, I'm not sure you guys better come. My son is sick, and I don't know. And we're like, okay, that's fine. We'll just stay here at your parents' place. And so the next day, though, he called us back and said, hey, he seems to be doing a bit better, so why don't you go ahead and try to come? So we said, okay, we'll come. So we arrived to his house at about 5 in the evening, and he came to the door with the little kid in his arms. And the little kid was like this. He's like, I'm really sorry. He said it looked like he was doing a lot better, but he's going back down again. And so we said, that's all right, don't worry. Oh yeah, he had already had he'd had this for a while, and he had been on antibiotics and a bunch of things like that too. But he was looking really sick. So we said, well, have you ever tried charcoal? No. We said, well, we've got some in the car. So we made a charcoal poultice for this kid. And you gotta keep in mind, this kid had never had charcoal in his life before, so this was bizarre to him. I mean, he was about 5, I think. And so he wasn't too keen on this idea, even though he was sick. So he got a charcoal poultice on his belly, and he was really squirmy, and so his dad was going to try to hold him to keep him with the charcoal poultice on. So he held him there for about an hour, and pretty soon, all of a sudden, it's like, this is not working anymore. And so they take the kid up to, and we didn't have all the psyllium husk and everything that we're going to teach you in a minute, so it wasn't quite as clean of a poultice, so they had a mess going. So they had to take him up to the upstairs bathroom at the top of the stairs and bathe him off. So they get done with the bath, and all of a sudden, this kid comes rocketing down the stairs. And now, you know how some kids, when there's visitors, some kids are shy and other kids start showing off, right? Well, this kid starts showing off. So he grabs his dinosaur tail and he's running around wiggling his dinosaur tail, and he comes along and he starts running around and he starts jumping and landing. Now, he had had a belly problem. His stomach was not hurting. He starts jumping and landing on the couch on his belly. And the parents are like, and they're looking at us, they're like, do you think it could work this fast? And we're like, oh yes, of course, of course. We were even shocked. I mean, he was like well in an hour. Apparently there was toxins from the bacteria or whatever that was going on, and that charcoal just absorbed it through his skin and set him on a course of getting well. And we stayed there. The rest of the time, he was fine. And we didn't get sick. So charcoal is very amazing. Don't underestimate its power. Now we're getting to your question, and that is, how do you use it? Well, it comes in many different handy forms. Tablets, capsules, those are all useful. You can buy, and I'll tell you different uses for each one. So the tablets, they're kind of nice, especially for kids, because they can chew them up. The capsules are probably better. Well, you can also use a charcoal powder, so you could just drink it in a slurry, put it in the water and drink it in a slurry. So like you might need this after potluck or something, or if you go to somebody's house and the food doesn't agree with you. So it's better to have the capsule for that scenario, because it's probably not socially graceful to come out of the bathroom with a big charcoal smile. Like, thanks for the lunch. The food didn't quite agree with me, but no, it's better to take the capsules, and then it's a little more discreet. You see what I'm saying? But the powder is actually the most versatile, because you can use it for a slurry. You can just drink it down. You can use it for a poultice, or you can use it in a biscuit recipe, or all kinds of other things. What you want to do is you want to get the kids or the grandkids used to eating charcoal. Okay? You don't want it like my cousin's kid, where they don't know what this is and they've never heard anything like this, and this is really strange. If you bake some biscuits with charcoal in it, they're going to love it. It's going to be like, this is amazing. What is this? You know, this is some new novel thing. Get them used to eating charcoal in various different ways, so that if they're sick, if it's an emergency, you're not going to, if they drink poison, then you're not going to have to try to convince them that they need to drink the charcoal before you can get it down them. You see what I'm saying? You got to have this around your house, especially if you have kids.
Sometimes mix them with the juice.
Yes, put it in some juice.
Mm-hmm. Grape juice, they kind of have a color.
Sure, the grape juice, you would hide it pretty well. Other juices, they would think it was maybe a little strange.
Hi.
Hi.
We're going back and forth. I just wanted
Are you
to
gonna
finish up
finish
with
this?
this.
Okay.
Yeah, I don't need that.
Oh, yes.
But I wanted to say, mothers are amazing. And mothers, while they're driving down the road with their child in the back who's just, you know, eating something toxic, they can get charcoal down their children while driving, right? You know that's true, Pam. Mothers will do what they need to do, right? And then watch the ER nurses watch the ER nurses trying to do it, right? But mothers, they can do it. Like, you get that down, right? So anyways, I just wanted to, before we just got off of the hydrotherapy demonstration. I just wanted to share with you, I gave you a handout so you didn't miss this, and it has a throat heating compress on the front. So read through that. It tells what it's for. It tells you what to be careful of. You know, silly things like I forgot to tell you don't make it too tight. You know, obviously, you know, putting it around the neck. Never mind.
Yeah, if
not
the
fun.
patient's head starts turning blue,
Yes, you know, you
didn't
got
do
it a
right.
little too tight. You know, so anyways, it just goes through and it tells you the supplies, it tells you the procedure, and then the next one is the hot foot bath that we did with Cisco, and then and each one tells you what it's good for, what to watch out for, and then the hot and cold shower Martin talked about. Be careful you don't do it when your stomach's too full, so you fall over after all this hot and cold
I
back and
told
forth.
them about
Okay.
fainting.
Okay, we had a friend who passed out doing that, and so yes, you don't want to do that. And then the fever bath. We didn't actually cover the fever bath, but the fever bath, I put it in there just so that you all are familiar with that. And if you need to do a fever bath, it's very helpful for people like cancer, that have cancer, colds, viral infections, and it kind of just walks through how to do it. And then last but not least, the hot and warm and hot fomentations, okay? And we're trying to teach you the principles here. So the warm and hot fomentation is good. And so it looks like, no, it's supposed to be hot and cold fomentation. No, that's actually done on purpose. We're saying warm and cold or hot and cold. That's what the purpose of that is. And so notice that if you're in warmth for 10 minutes, like if I leave the hot fomentation on for 10 minutes, it causes sedation. If I do it for 5 minutes, it causes stimulation. So if I'm trying to help somebody with pain, I'm going to leave the hot on longer. If I'm just trying to get the circulation stimulated, I'm going to be just doing it for 5 minutes and then doing the cold, and then so back and forth. So that's what that's what that is about. So it's back and forth, back and forth. Now we only did this for 2 because Fred was jetting out of here, but you would do it 3 minimum. 3 cycles minimum.
3 to 5.
Yeah, and I'd probably do it the first time only 3, just to make sure the person's tolerating it well. The next time 4, the next time 5, and then so just okay. So that's what I wanted to say before we ended that.
Okay.
And I guess we're just giving
Thank you,
them
Janelle.
whiplash. Thank you.
We're almost done, so
Okay.
I'm going to have them down there in
Okay.
5 minutes or less. All right, so I was talking about charcoal powder being the most versatile form. You could, like if you had a snake bite or something and you only had capsules, you could probably take the capsules apart and dump them out, but that would be a pain in the neck and you'd lose valuable time. So you may want to have some different types of charcoal forms available for various different things. And you're going to want, if it's a serious poison that somebody's swallowed, you're not going to want to just give 1 or 2 capsules. You're going to want to, I mean, it depends on the size of the kid. I'm not going to give a specific number, but size of the kid. Yeah, I mean, it depends on the toxicity of the poison they swallowed too, you know. No, I mean, yeah, I don't think so. I mean, yeah, everything can be deadly in enough, right? I mean, too much water, you can drown. I mean, so yeah, I would, if it's a very serious poisoning, and it's a child, I would start getting it orally. I would start putting it on their belly and liver by poultices, or get them in a tub full of charcoal, something. I mean, just, you don't want to underdo it if it's a serious poisoning. So, some of the side effects, it will turn the stool black. Some of you might be thinking, well, that's pretty obvious, but I've actually had some people get kind of freaked out because they saw their stool after taking charcoal and they're like, am I bleeding internally? Blood does turn black if it's high up in your intestine because of the digestive process, but yeah, charcoal turns the stool black. Some people might experience some constipation. I think that's usually more just from using it a single time. If you actually start using it small amounts every day, I think that that can be overcome. Plus, as you start to eat more healthy food, you're going to have more fiber in your diet, so constipation is going to be less of an issue. Okay?
What if a person is taking medications? Doesn't that lead?
It will negate any medication they take. Charcoal knows that all medications are poisonous. Or at least that's charcoal's opinion.
Yeah, there you go.
So it will negate the medicine, yes. So if you don't want to negate the medicine, you don't give it at the same time. Probably 2 hours after. You would want to give the medication at least 2 hours after the charcoal. Charcoal doesn't seem to absorb nutrients. Some people are worried about that. If you're worried about it, just don't take it with the meals. But the fact is, sometimes you want to take it with the meals because maybe you just got food poisoning, right? Well, then you're going to want to take it to the meal. Forget about the nutrients, right? You got to absorb the toxins from the bacteria. Some people will actually get some diarrhea from charcoal. It seems to irritate their bowels. I don't know. And I'm not sure what the difference is, but you want to drink plenty of water when you take charcoal because that helps alleviate some of the constipation issue. And you want to be careful with putting charcoal into a fresh wound. So I just told you about treating a wound, a diabetic wound with charcoal. And if it's a diabetic wound that's got crust and partially infected and stuff like that, it's not going to hurt it to put it directly on the wound. But because all that yucky stuff is going to come off with the charcoal, okay? But if it's a fresh wound, it can actually cause a tattoo if some of the charcoal heals into the skin. In fact, some of the ancient tribes in New Guinea and other places would use charcoal to make tattoos. They would make the cuts in their skin and they'd rub charcoal into it to make permanent marks in their skin. You want to separate it from the broken skin with a thin porous cloth or paper towel if it's a fresh wound. It can still absorb things through a thin cloth or paper towel. Yeah, the towel or paper towel has to be wet. Charcoal always has to be wet if it's going to do anything on the outside. Once it dries off, it's not absorbing anything. So here's some things for further study. I have a video online and on DVD called The Amazing Power of Charcoal, which is basically this lecture. There's a good website called charcoalremedies.com and Charcoal House. These are some friends of ours who are Adventists. There are John and what's his wife's name? Kimberly Dinsley. And they live in Nebraska, and they have a charcoal business, and they sell everything charcoal. And I mean to tell you everything charcoal. So you can buy charcoal underwear and charcoal socks from them. Yes. You can buy all kinds of charcoal things. So you'd be amazed at what kinds of things you can buy from them relating to charcoal. So, and Charcoal House is their website for selling charcoal. Charcoal Remedies shows some of this stuff. And he writes a book called charcoalremedies.com. It's the book is named after his website, which has a lot of interesting information. Doctors Agatha and Calvin Thrash wrote a book called Prescription Charcoal, and David Cooney wrote a little pamphlet called Activated Charcoal, Antidote, Remedy, and Health Aid, and then he wrote a medical research textbook called Activated Charcoal and Medical Applications. And that is an amazing book. It's an expensive book, but if you really want to see some of the science behind charcoal, you want to buy that book. So it's time right now to go down and spend a few minutes before you get your food learning how to make a charcoal poultice. And we've got this set up really efficiently, so it won't take too long. So go and see what Janelle has for you downstairs. Thank you.
I have you come into the little room, and one per family, and then we might have one extra, and you guys can decide who gets it. But looks like about one per family will work. So. I'm gonna turn this on, hello, hello, and then you guys can practice up there if you need to. So everybody, a paw sent, paw, I think I'm getting that right, so I handed this out to everybody, and if not, I've got extras. Grab it, I don't have any right up here, so everybody press together, and hopefully one per family, and there may be an extra one. Okay, are we rolling? So let's go ahead, just grab a chair, and we've got 2 here, and we've got a 2 over here too, so, yeah, there you go, yeah. Maybe, is this everybody? Because we still have more and we don't want to have leftovers. Oh, here comes somebody. Are more people coming? Good, she saved a spot for you. One per family, but then if it was everybody that was upstairs, I think we're going to have an extra, so we'll just see how it goes. So good. Yes, let us know. We're hoping that the audio is going up, but if it's not, they're getting my audio here, so. Okay. Oh, okay, well, we'll see.
This one more table here.
Okay,
A spot and stand still.
okay. Ooh, dizzy. Okay. Okay. Okay, except he's gonna have to move it a little bit. Okay, so now let's go ahead and start. I'm gonna read for the benefit of the people online what the poultice is. So there's a large poultice, and we have lots of extras, so if they want to swing by and grab some of these later, that's fine. They'll be here somewhere. So the recipe is for a tiny recipe that we're going to be doing today, which will fill up a sandwich bag. And, oh, good, everybody, is there an extra spot anywhere, or okay, your support, all right. It's 1 tablespoon of charcoal powder, and an equal amount, 1 tablespoon psyllium husks, and then we need a 1/4 cup of water. So we've pre-poured a 1/4 cup of water for everybody. And then into that, we put 1 teaspoon of olive oil. It could be flax oil. We just about used flax oil, but they had olive oil here. And flax oil would be really good. You're putting this on the skin, that would be very good. The oil makes it easy to peel off later. These are actually quite nice. And so what you're going to do is you're going to mix it up, and it's going to look like this when you're done. All right? So this can go into the freezer or the refrigerator. It will mold eventually because this is natural products, so it will mold.
I get her audio, so we're still recording, I'm
Okay.
still listening to you talk online,
But,
we're not connected to the Apple TV on his video.
oh, okay, all right.
We're looking at the sanctuary while listening.
Okay, well, that's nice. Okay, so we're trying to tell what we're doing. So it's this nice sandwich bag, and of course, this makes it really non-messy. I love this about this recipe, is it's non-messy. So then when you actually use it, this is what I would do, is just like if I have a kid who I just got stung, well, good, you don't want to put this whole big thing on. You're going to actually cut like 1 inch out, put it on that spot that's been stung. So like what I'm going to do is just show you how I would use the whole thing, though. I would take it and I would cut all around it, all around the edges, just like this. See? And then I will actually do a little sting here, okay? We're going to do a little sting here. Somebody just gets stung by a bee. So you take it, you don't take the plastic completely off, you only take it off on one side. That's the side that goes to the person, right? Don't forget that. It's not going to work if you put it on with the plastic still on. People say, I've had people afterwards like, how does it pull through the plastic? It doesn't. Yeah, it doesn't pull through the plastic. You have to take it off. So then you're going to put it straight on wherever that bee sting is, and leave it on. If you get it acute sting, perfect, and you're ready, you put that on for 5 minutes, 10 minutes, take it off, throw it away, put another one on. You're pulling the toxicity, and so you're changing, pulling. Okay, so and the same with like a snake bite or something like that. Don't just slap it on and then think, oh, we'll get it off in 8 hours. But do that if you're trying to just kind of generally detoxify. Don't go past 8 hours because then apparently it starts to resorb back into you. So 8 hours, take it off. The other reason you do 8 hours is because this is not allowing your skin to breathe normally, and you will get a fungal infection. So the fellow that Martin was telling you about, that we were doing charcoal poultices and papaya, green papaya, we had to be careful because we could throw him into a fungal infection if we didn't give it time to dry out. So we would only do it 8 hours in a 24-hour period.
What can you wrap around that though?
You can
Keep it
either,
on there.
I would probably just do this with paper tape, or I would do like a Coban, but probably, I really like paper tape. Paper tape is very nice for people. They usually don't have as much allergy to it. It's easier to get off. And paper tape, 3M paper tape sticks really good. Sometimes I'm like, how do we get this off,
Yeah, I'm allergic to tape, so I
Okay, yeah, 3M seems to be a little more adhesive to some of the other ones that I've tried. But you can try whatever, it might be different here. So then what I'm gonna do with this is, if I just did this little bit, I'm gonna just put this in another baggie so that it doesn't dry out. So, and then I'm gonna put that back in the fridge, right? So, and we're gonna have it. So what I want you to do now that we are here with all of our ingredients is I'd like for you to open up your baggie and kind of in a manner and put the charcoal in first. All right. Very carefully drop that charcoal in. Oh, you all are just like pros. Okay. Tap that out and then put the psyllium in.
Now, does flaxseed work? I mean, brown
Flaxseed will work absolutely wonderful, and that flax is wonderful on the skin. The reason we didn't do the flaxseed is usually if you don't have 20 minutes to wait, you usually have to stir up the flax and boil it, and then it hardens up. So, now if you guys close those bags and then shake them up and mix them. Make sure you've mixed the flax in with the charcoal. And notice we used psyllium husks today. The plantain plant is where you get psyllium from, and so we have psyllium husks. Usually psyllium husks, or you can buy it this way and blend them in the blender, with a cap. And then, yeah, there you go, thank you. And so that will enable you to have a very fast reacting thing. Okay, so what you're going to find so once you've got it pretty well mixed, you got the corn. I'm going to have you go ahead, open it back up. Make sure it's all before you open it back up. And then I want you to kind of swirl that. Okay, so we have 1/4 cup of water in your clear glasses, and on the top is olive oil. I just put that on the top. So you're going to try and emulsify that as best as you can. It always seems like a big waste. There's always a lot left over of the oil, even after you do that. And then pour it in there fairly rapidly. Don't just take forever to drizzle it in. Just pour it in there, and then close that bag and get mixing fast. All right? Oh, use it all. Yep, all at once. You got to put it all in, close that bag, and start mixing it because it's going to just be all watery at first, and you want to mix. Otherwise, you're going to have a clump of psyllium here, and then you're going to have there. Wow, yeah, you guys are good. Just make sure you have it closed before you shake it too much. Good. Just make sure you get the corners. Go to those corners. Get the corners all mixed up. Okay, good. Now, when you feel like it's really well mixed, then start flattening it out. And you may have to open a little bit of the bag to let some air out. Just don't hit it hard while you're letting air out. There you go. So nice and easy, and you'll see how it starts to stiffen up. At first you're like, I don't think we got the ratio right, but I think you'll find that you do. Now get it, yeah, see yours is getting there. Good. So now start so that it's nice, smooth, and uniform. And open up and let your air out, otherwise it'll be a little harder too. Good, wow, you just did so good over here. He's like doing great. Good. Okay, now flat and then just nice and pat it out flat. Good, you're getting it. You're getting it. And then I try to like flatten it out all the way, so that it's all edges and corners are full. Good. We have some really nice looking poultices around here, don't we?
Janelle, how long did you say that these would last in a cold environment?
In your fridge, I would say they'd probably last a week or two. They do start to mold. So I usually stick them in the freezer. Now when they're in the freezer and you take something like this out, and it'll break pretty easily. So if you can take it out and let it, thaw a bit before you start messing with it. Now if it's a bee sting or if it's, something that you would like to move along rapidly, this is so thin, it'll melt really quick just between your.
So for camping, keep it in a cooler,
Yeah, I'd
especially with kids. on
Yep, put it in your
campus.
cool box. Yeah, absolutely. It's something you have to, and if you forget, pull a coal out of your campfire, pulverize it, with something with the top of your.
This would be ideal with
Yep.
camping trips.
Yep.
The other thing you could do is mix it with dry ingredients and keep it indefinitely, almost like that.
Right, yeah.
Then it wouldn't have to be kept cool, and you would just add the water. You could forgo the olive oil if necessary.
Right. Just pulverize it up,
Especially if you're on a
get it
camping trip.
moist,
Well,
and
that
get
would
it
be
on.
better a camping trip, just
Yeah.
after
Yeah.
drying the bag out the water.
Yeah.
Right. But if you can use the non-activated charcoal in a pinch if you're just
Okay.
camping and you pull it out or it's already cool. Just make sure it's cool before obviously you put it on.
You said that you can mix the dry ingredients and can last for a long time when they are mixed together.
Yeah.
That's a good point. You could just mix your dry ingredient in a bag and take that with you, and then when you need it, yeah. You saw how rapidly it's set up. Now, I did put these in the fridge for a little while, and I find that they do kind of like set up. If you stick them in the fridge and just let them sit there for like a day, it seems like it's going to be an easier gel. Now, you see how nice that gel is? We actually were, people will come and they need charcoal on their legs, and we're talking a huge area, and it can use a huge amount of charcoal. And see how this is just stuck on me? And I can pull it off, and it pulls off pretty easy. It's not like it just, and I can just throw that away, and wash that up. And generally the oil, if you can get the oil mixed in there good, sometimes you just get a perfect mix and it just pulls off in just this kind of like gel, and it's just like, wow, that was perfect. I mean, this was pretty close, but if it would have set up for a little longer. But that's actually sticking to me. Now, this is, quote, a cheaper way to do it. It kind of is. You still have the cost of your bags, which, may not be that much. You have the cost of your time, and you have the cost of your charcoal and your oil, and, but, so we sell just
Commercially made sterile dressings, charcoal
Yeah.
dressings that you can peel off the back like a Band-Aid.
yeah.
And it'll stick right on your skin. And those dramatically increase the compliance for patients who want to do detox every day. They put those on the liver every day, and they don't have to have the mess of making it. The problem is they're a lot more expensive.
Very much.
They're $16.95 for a pack of 5x5 dressings, or
Yeah.
4x4 dressings.
And see, we got spoiled
So-
because we had a Korean company that was then bought out by a Chinese company. that would make these huge charcoal poultices that were on with fabric on one side, and you could do that too. If you did these with, just rolled them out with fabric on one side, you could do it. And we got like a big pack of these. There was like 8 in each one, initially 10, but then 8, and they were folded over in this pack. And we would cut them in half, and they would be this big, and we would put them over the liver of people. And at first we were like, are you kidding? That is so expensive. And then, we had people do this, and we would make our own poultices, and we would go off on walks, and we didn't quite have the process. And I'd be walking along with my patient, and then I realized their poultice is down around their ankle, and I'm like, oh, that's just great, and so we'd have to, try and get in, and then we'd send them home with this, whole detox protocol, and they just didn't do it. They just wouldn't do it. I'm not putting that on me, and so we found that the compliance really went up, and then unfortunately that company, I can't find it anymore. They were just fantastic. And so now we're back to buying, like Martin was saying, they're less than half the size of them, of the ones that we were getting, and they're like $16 for just like 5
Which is
of them.
still not too bad.
It is.
But it's a lot more expensive than
Yeah.
doing it homemade. But if you're
Right.
gonna really do a detox protocol where you're doing it every day for 5 days a week for a year,
Mm-hmm.
you probably don't wanna do it homemade. At least if you have the money to buy the
Well,
commercial ones.
but if you're doing it for huge areas of, your body, which some people will, they'll have it for a leg, and that's where we got this poultice recipe from, was a lady who had problems with her leg, and she was having to put them on, and they were making these huge poultices, and she's still got her legs, and it's been years, and so, sometimes you just do what you got to do, and you would pay. They were probably using the equivalent of $15 of poultice, area, every day for her, and so you're going to do that a lot cheaper if you make it yourself. I'm trying to remember whether this came from Black Hills or Eden Valley. I think it was actually Black Hills that they got this particular recipe from. Now, I've made it, smaller, but I mean, they were mixing the third cup of psyllium and a third cup of charcoal. That's how much they were doing, and that was making a gallon size. And
Kyle had a question.
I'm just curious, active charcoal what exactly makes it active?
so what they do is they make the charcoal, and then they expose it to a lot of extra either oxygen or liquid, and it pops the carbon that has been formed. So it pops it, and so it just makes it kind of like it can adsorb a lot more. It makes it so that it becomes more honeycombed,
It has
apparently.
more surface area.
Yeah.
Oh, is that kind of what you were trying to talk about upscale?
Yes.
Okay.
More surface area. So that's why if you're on a camping trip and you don't have activated charcoal, don't worry about it. It will still work. It's just the activated charcoal is going to be something like, if you're in an ER and they're trying to, give you something, they want to make sure they have the most absorptive, the most absorptive carbon possible. And it's actually quite a science, because they want to know what size it is, and I mean, there's a lot that goes into it.
Okay, thank you.
What is the recommended size for liver detox and for how long? Just an average.
I would do, I would make probably the larger poultice and cut it into either half, at least half.
How many inches are we talking about?
Well, I would like a gallon and half. That would. Well, this would be like cutting it in a quarter, but I like it if the size about this size.
Of this size, about the double of
Yeah, about double of that.
Okay.
And so the reason is because, and the liver, where is the liver, people say. So it's just, the liver is actually, it should be, if you have a healthy liver, I shouldn't be able to hook your liver underneath your ribs, right? I shouldn't be able to feel that liver. If you do feel it, you definitely want to put the charcoal over that area too, but this is where the liver is, okay? And so you want to put that kind of a little bit over the top of your rib cage and then let it hang down a couple of inches below that area. 8 hours,
8 hours
like
for
we'll,
how long the period of time?
so what we tell people for like detoxing, helping to detox the liver, we'll tell them like 3 times a week. And the only reason we tell them that is because compliance and the effort. You could do it every day, but I wouldn't do it more than 8 hours in a 24-hour period, just because you'll make it so you're damp on your skin that long. We weren't made to be fish. Well, I mean, if a person's just trying to detox or what,
It's heavy metals for a year.
For the year? Okay.
yeah, I mean, just, or, like we've seen people, like we'll measure their uranium level is high. Did you already talk about this? Probably
give
not.
it a
So,
toxicity lecture.
yeah, so their uranium levels, for example, may be high. And there's really no way to detox from that. Uranium has a longer half-life than you're going to live and so forth. And so you're going to have to just assist your body to detox in whatever way. And might go into your bones and you're just never going to get it out. But what we have seen is, people are obviously eliminating it because we can find it in their hair, or if you tested, you could find it in your fingernails and things. So obviously your body is getting rid of uranium. And so we'll test that, and sure enough, their uranium's high. And so we started just kind of, telling people, different ways to detox. And we found this one couple that we gave them this whole protocol, and they were supposed to wear charcoal poultices, and they were supposed to do this and that. And they came back in 3 or 4 months, and we repeated their hair tests, and one of them had like plummeted their uranium. Another one hadn't. And I was like, oh, that's really interesting. Let's find out what they did different. It's kind of nice when people don't do what you tell them to do sometimes, because then you learn something, right? And so they came back, and I was like, what did you guys do? And then I showed them, and I said, you did something different. And they were like, yeah, we can tell you what that is. We put one charcoal poultice on him, and he said, not doing that anymore. And she continued to do the charcoal poultices like 3 times a week. And so her uranium plummeted.
We've
His
seen
did not.
drops of 90% drops in the amount of heavy metals, especially uranium, in about a year.
So that said, I'm not sure that the charcoal is pulling the heavy metals. And if you go and look at the research, it's not going to necessarily pull the heavy. So I'm not sure exactly what's happening, but there's a decrease in what was being excreted in their hair. So I don't know if it's allowing your body to detoxify better or what happened. I'm not saying, charcoal uranium. I'm just saying what we saw in our patients was when they did charcoal poultices, their uranium levels, for whatever reason, dropped.
So not taking it, drinking it, would it have the same effect?
It didn't seem to have the same effect. It seemed to pull it better through the skin for whatever reason, and I don't have an explanation for that. Somebody probably is out there somewhere. But it did seem to help detoxify. It's 8:10. Yeah.
I'm sorry, but that flaxseed stuff, you said about boiling it?
Yeah, if you boil the flaxseed, like I would grind your flaxseed. Well, it will work unground. But if you grind it, it's going to make a better, more uniform sort of poultice. So you grind it, and I would just use it the same as the flax, like a 1-to-1 ratio. But it will, did I say, yeah, psyllium. So if you,
What do you say about cooking it?
well, if you boil it, it will make it, it'll cook the
gels
flax
better.
and gels quicker. Like,
You don't have to.
if you have 20 minutes to just set it aside, like
see.
we went, yeah, like one time we were someplace and Martin got super sick,
We got food poisoning.
Yeah, he got super, super sick, and so I woke up and he's coming back, to bed. I slept through it, everything, and I'm like, what's wrong? And he's like, I am just so sick, and I'm just, about to pass out and all this stuff. And so I only had just, I mixed the flax on a paper plate, and with charcoal. I don't even think it was ground flax, and then I just let it sit there for about 20 minutes, and then I put it on him. And so it'll work. Anything that will gel will work, and the flax it takes a bit longer to kind of set up. And
Chia seeds?
oh yeah, chia seeds would work. And you know what I just did the other day to my dear mother? I was putting a comfrey poultice on her, and I had the comfrey, and I'm mixing it in there, and I went, and I was like, oh, I have some flax, and I pulled it out of the cupboard, and I mixed it up, and I was like, this just doesn't, not flax, I thought it was psyllium, and I was mixing it up, and I thought, it just doesn't seem like it's quite right, so I went and I looked at it, and there I had written in ink that had kind of faded, ashwagandha. And so I was like, oh, that's cute. I just put ashwagandha in her poultice of comfrey, and I thought, well, I don't know, maybe it'll be okay. And so then I went and found the flax and mixed some of that in there too, put it on her, being sure not to tell her that I did it because I did not want it to interfere with the therapeutic belief or the belief in the therapy. And she woke up the next day and was like, that was way better than, and so now we're going to be incorporating ashwagandha. So, into her poultice of comfrey when she gets, a bad backache, where the bone is hurting. So, and so anyways, anything except the ashwagandha doesn't have the gelatin, psyllium. I mean, you could probably use something like oat flour. That has some gelling. But the nice thing about the flax or the psyllium is it's very pliable and it holds moisture. And the flax is actually beneficial. It has really good oils in it. So, yeah.
Flax helps it not to stain your skin.
Okay.
Found.
Yeah. All right. So. Yeah, thank you. So take those home, get them flat in your refrigerator, and
So how long will it last in the freezer?
it could. I mean, it's probably not going to mold in the freezer, but what I've noticed. What I've noticed about it being in the freezer is it gets freezer burn eventually and kind of like dehydrates, and then it just kind of breaks when you take it out. So I'd say a couple of months in the freezer at least. What's that? Oh yeah, is it still damp? Okay, so that shows, if you were asleep, let's let you loose though, right? And she's like, I'm like, are you choking? She's like, no. Okay, let's get this off of you. Thank you for being a guinea pig. Some people put cellophane over it. That would make it hold its moisture longer. And this one, well, there we go. See how it's a lot less wet than it was, but it probably would take you another hour or two at least to dry that out. Oops, sorry. But yeah, so
My daddy lived to be 100, but there were 12 kids and 7 of them died from diphtheria.
really,
He just died 5 years ago.
aww,
I'm sure he loved this.
yeah, and apparently,
he almost died, him and his
wow,
older sister, and the doctor said, I don't know what they did to him though. The doctor said if he wouldn't have been there when he did, that they would have had 2 other dead children, which would have been my dad.
wow.
But I don't know
Well,
what
I wonder, so a lot of them would take something antiseptic and swab their throats.
they did. That's,
And apparently that made the difference.
yeah, I don't know what it was.
Yeah, yeah. Oh, yeah. Oh, I'm so sorry, yes.
Thank you.